This is Michael Smith of MedPage Today in Denver at the annual meeting of the American Association for Cancer Research. While most children with acute lymphoblastic leukemia, or ALL, do well on therapy, a minority relapse quickly, and for those children the prognosis is poor. Dr. Charles Mullighan of St. Jude Children's Research Hospital in Memphis.
Over 80% of children now experience long-term disease-free survival with ALL. There are various genetic lesions that we know are associated with very good outcome, but there is this subset of patients that have a very poor outcome. So the study that we looked at was designed by the Children's Oncology Group to focus on those children that have high-risk features. There are various ways of identifying children that are at high risk of relapse. For this study, they included clinical features such as older age, sex, and high white cell count in the peripheral blood at the time of presentation.
Exactly why they relapse so quickly remains unknown, but Dr. Mullighan and colleagues are trying to see what genetic factors might play a role.
The goal of the initial study was to use a combination of different genetic profiling approaches to try and get to the question of what are the genetic features that drive a high risk of relapse. And those approaches included profiling across the genome DNA copy number changes, so gains and losses of genes, gene expression profiling, where we look across the genome to profile the level of gene expression, and also an ongoing project where we're sequencing candidate genes for point mutations. Now, in the first study that we reported earlier this year in the New England Journal of Medicine, we had found that by looking at the genetic changes, gains and losses of DNA across the genome, that changes of a specific gene called Icaros or XZF1, when present, was associated with a very poor outcome. So approximately 75% of children that had alteration of that gene experienced relapse at some time.
Clues uncovered in that study led them to suspect there might also be mutations in genes that code for cell signaling molecules called tyrosine kinases. They're reporting here, in fact, that mutations in members of the JAK family of tyrosine kinase genes are also associated with risk of relapse.
So we looked both singly and in combination with our previously identified prognostic marker, that of Icaros, to look at the association with outcome. And the associations were quite striking. So children that had the combination of both an Icaros deletion or point mutation and a JAK mutation had almost an 80% risk of relapse at 4 years, which is extremely high for childhood ALL. In contrast to children that had neither alteration, who had a 24% risk of relapse.
Some in vitro experiments suggest that blocking JAK activity might have a therapeutic benefit, and in fact several JAK inhibitors are under development. But the path ahead still has some hurdles, Dr. Mullighan said.
So that suggests from the experimental evidence that it will be a useful approach, but it requires testing further to see if it will kill the cells, and then ultimately testing in patient samples as well.
In Denver, I'm Michael Smith, MedPage Today.